I'm Leanne Rhymes. Since the age of 2, I have battled my disease every day. At one point, 80% of my body was covered with psoriasis patches.
That was Senior Leanne Rhymes talking about a problem that plagues more than 7 million Americans. Psoriasis is one of those skin afflictions we all try to cover up and don't want to even discuss. But thanks to some new studies and clinical trials, some new relief is in sight. Here to shed some light on these developments, please welcome the medical director for the Center for Clinical Studies, Dr. Stephen Tyring. Hello there.
Good morning. Good morning.
All right. I know Leanne Rhymes, and I remember, like, we were actually in Dallas working together, and she would wear long sleeves in the middle of the summer, and you'd think, why is she wearing those long sleeves? She was covering up that psoriasis. Let's start with, what is it?
Well, psoriasis is a chronic inflammatory disease characterized by red, scaly, either patches or plaques. Now, traditionally, people think about it being on the elbows or knees, but it could be any place on the body, and it could be every place on the body. Yeah,
it can look unsightly, and so there are a couple of questions people ask, and sometimes it's, could this be spread to somebody else?
Oh, definitely not. Psoriasis is not an infectious disease.
All right, and then is it genetic?
Genetic in about half the cases. In other words, half of our patients have relatives, either close relatives or distant relatives, that have psoriasis. But the other half do not, and we don't really know why those people have psoriasis.
Yeah, there are treatments that are out there, but they've only had limited benefits to the patient. So that's the reason why these trials and things that you are doing are so important.
Well, very true. In the past, in the dark ages of the 20th century, we're treating psoriasis as if it were just a skin disease. But really, treating the skin is treating the tip of the iceberg, because if you put topical steroids or other things on the skin, you're not really addressing the problem. It's a inflammatory disease where the white blood cells are attacking the skin, and in 1/3 of the patients, those white blood cells are also attacking the joints. So it's quite common for people to have joint problems, psoriatic arthritis, along with the psoriasis. So if you just treat the skin with a topical drug, cream, ointment, ever what, you're really not addressing the source of the problem.
Yeah. I'm going to back up a minute and talk about what the Center for Clinical Studies does.
Well, the Center for Clinical Studies, which is located in 3 places in Houston, Cypress, Texas Medical Center, and in Webster, is trying to find better treatments for a number of skin diseases. Psoriasis is one of those, which we have found a degree of success, but now we're doing much better than we've done in the recent past.
All right, you have some of those investigational medications being researched in your clinics. They're different from the therapies of the past.
In the past, of course, from just treating the skin to realizing that psoriasis was an inflammatory disease and using medicines that were much too powerful that could help psoriasis, but of course damage the liver or damage other internal organs, we have fine-tuned it to blocking specific proteins. 10 years ago, the first drug got on the market to block one of those proteins, and it did help people's skin and their joints, and that was a major step forward in 2003. But now, in 2013, we're taking another major step forward, and whereas complete clearance used to be the exception, today it's the rule. We have patients that are virtually covered with psoriasis coming in, and after a month or so of treatment, they are completely clear.
Wow.
But they're not cured. It can come back. But clearance is now the rule, not the exception.
Yeah, and the other thing too is getting rid of it, because it does become itchy and just a nuisance in a sense, but also for their self-esteem.
Well, very much so. It affects every aspect of their life. If it's on their palms and soles, which could be only 4% of the total body surface area, it affects their interactions with others. People don't want to shake their hands. They can't do their manual work. If they're on their feet, they can't walk, they can't do any type of labor or social interactions, so they can't interact with their significant other, find a significant other, and their self-esteem goes down. And, of course, it also is associated with a lot of problems other than just the joints.
Yeah. All right. So there are a lot of people out there who are willing to help. And so they, hear sometimes about these clinical trials and things and would love to be a part of some of these things. So how do they do that?
Well, they could call one of our numbers, such as 281-333-2288, or go to our website, ccsTexas.com, and get information. But they don't have to be part of a clinical trial. If they want to get the latest, and we think the best treatment, in my 3 decades of experience in treating psoriasis patients, this is definitely the best treatment. But if they want to do the standard of care. We're happy to see them as regular patients or study patients. Either way, it's their choice. And we have 3 clinics, so no one clinic is more than 30 to 40 minutes away from anybody in Greater Houston.
That would be awesome. All right, if you'd like to schedule an appointment with the Center for Clinical Studies, just call 281-333-2288, 281-333-2288. Give you that number again, and they will be happy to help you. You can also check out their website at ccstexas.com and on Facebook at Center for Clinical Studies. Big relief for a lot of people. They can get some there.
Yes.
Thank you very much.
We're happy to see them. We're open 5.5 days a week and happy to see them at any of our 3 clinics.
All right. Well, still ahead, we're going green for lunch. The recipe worth an award. Thank you.